Good evening, everyone, and welcome to your Health 360. My name is Jacqueline Adibija. Last week, we started with talking about common eye conditions. And I remember that last week, with the questions that we got, we thought it would be wise to have the doctor. He will tell us what kind of doctor he is. I know he's an eye doctor, but I know they also have different branches, Dr. Okpanaki. You will tell us which one you are, but I'm glad to say Dr. Okpanaki is back, Dr. Mohammed Okpanaki. He is back in the building. And in fact, we had World Sight Day just yesterday. That was World Sight Day. And, do we really need to talk about the importance of our eyesight? Well, maybe we do for some, but I'm sure a lot of us know already how important our eyesight is. However, just to give us an idea about what happened yesterday, Dr. Okpanaki, you want to quickly tell us what you were able to do? First and foremost, what kind of doctor are you? I know there are optometrists, there are ophthalmologists, and I don't know. So which one are you?
I'm currently in training. I'm in profession of medicine. When you graduate from school, you go through series of training to become a specialist. And I'm a medical doctor by profession. First, you must be a medical doctor first to be an eye doctor.
Okay, but I do know that you have your passion in that field of eyesight.
So, you're talking about optometrists and then technicians. We have some technicians in the same field who work with the eyes too.
Okay.
Optometrists are those who test people for glasses, basically. Then there are opticians who produce glasses for people.
Okay.
So for me, I'm under training currently. I'm hoping to become an ophthalmologist. I have a few years left to achieve this.
Okay.
Yes.
All right. So thank you very much for that clarification. Yeah. Let's jump into some of the activities that took place yesterday, because I'm interested in that, because there were some activities that you carried over and some people might want to buy into that, because information is power.
Okay. Thank you very much for the question. Basically, during World Sight Days, is a day that is set aside by the UN Assembly. Just like many other days, they're usually, I won't say celebrated. Usually those days are set aside to sensitize people on certain issues. For example, today is International Hand Washing Day. Issues that have to do with health, most of the times mental health, physical health, and what have you. So yesterday, 14th of October, usually in October. Yesterday, 14th of October, was set aside for this day, which is a World Sight Day. And the world is currently moving away from curative medicine into preventive medicine. Yeah, preventive medicine is when you want to prevent certain diseases or certain problems from occurring, while in curative, you want the problem to occur, then you treat. But the world is moving away from treating, especially for diseases that are preventable. And we just realized that a lot of eye diseases are actually preventable. The sight is precious to human, but you made mention of something the other day during our last meeting. You said people don't really know how precious this sight is until they lose it, and that's just the truth. Most of the times people just see and they just feel, I am seeing. But the moment that sight is lost, in fact, a lot of things will go very, very wrong with individuals like that. They start running helter-skelter to seek for all sorts of help, and health, as we know, is expensive. we are lucky in this part of the country. We are still subsidizing health. People will not understand that concept, but health is still being subsidized. And a lot of times to achieve this, there are compromises. But I don't want to talk about that. But that's it, the World Sight Day. And the theme of yesterday was love your sight, or love your eye, rather. You know, and like I said, we want to move away from preventive into preventive. We want to move away from curative to preventive medicine. Now, as part of activities we usually do, we try to see, for example, in National Eye Center, the CMD under the leadership of Dr. Al-Hassan Babani Mahmoud gave an order that patients or individuals who come in that wants to be screened should be given that opportunity. Normally, you have to go to the hospital, queue up, open a card, go through a process to see a doctor. But yesterday, that process was waived for people to enjoy free services as part of our corporate social responsibility in National Eye Center. Yes, we had that done yesterday. Before that, we actually met with individuals, patients and their relatives that came to the hospital for treatment, and these patients were put together to be sensitized. They were educated about certain things they could do to help themselves in cases of eye problems. You know, in years past, we usually organize free surgeries for indigent patients that we've identified over time. We pull these patients together during World Sight Day. Is usually an opportunity for us to sensitize the public and then offer free surgeries to patients, you know, who are indigent, who we feel are eligible. So we do this, but unfortunately, it wasn't possible this year. We have to reschedule that part of the program for some reasons. But we hope that in subsequent years it will happen again, and we are still optimistic that we can still do that this year. Basically, that's it for our activities yesterday, and then we went through some to sensitize people through media and what have you. So those are the activities for yesterday.
All right. Sorry for the distraction there, Dr. Opanaki. Now, I'm glad that you said that you have freebies coming up. You said during your annual general meeting. So hopefully, I'm hoping that people are going to be listening and listening to this station, this program, because I'm going to keep you up to date on that. Now, quickly, we need to move on to even more serious matters. Last week, we talked to people, and there were quite a number of people who called in to ask about glaucoma and some other more serious eye conditions. And that's why this week I want us to start talking about more serious eye conditions, and starting with glaucoma. Can you tell us what it is, why it comes about, what factors precipitate glaucoma, and what can be done about it?
Okay, thank you, Ms. Jacqueline. Glaucoma, like I said, is a neurodegenerative disease. Neurodegenerative in that it affects the optic nerve. Optic nerve is one of the nerves in the body, and nerves are made up of neurons. So, it's a neurodegenerative disease in that when this nerve has a problem, an individual can lose his sight completely, you know. And glaucoma is one of the irreversible diseases or diseases that cause irreversible blindness. Is one of them. In fact, it's the leading cause of irreversible blindness in individuals. Okay, you talked about the risk factors. Okay, a survey was conducted worldwide. Like I said, it's irreversible. It's the leading cause, and a survey was conducted in Nigeria in 2007. It was a very robust and comprehensive survey that tried to look at blindness, and that survey also tried to give us a picture of similar fact that glaucoma is one of the irreversible blindness.
Okay, before you go into that, we need to quickly go on a quickly go on a commercial break. Dr. Mohammed Okpanaki with us in the studio. We'll be right back after this commercial timeout. Do not stay. Okay, do not go anywhere. We'll be right back. This is Invicta 90.9 FM.
This is what happens when you open up a bottle of Fanta. It's bubbly excitement waiting to break free. It's living in the moment. It's not caring who's watching. It's putting your enjoyment first. It's adding color to the gray and making time to play. It's not taking life too seriously and adding a touch of crazy. Fanta is flavor. Fanta is laughter. Fanta is color. How are you going to color your day? Fanta. Color every moment.
Wani yana tambaya ta, wai me zan yi idan na samu nasarar lashe wasu makudan kuɗaɗe? Na yi tunanin na naira miliyan 1. Sai na gane yawan su bai kai haka ba fa. Wataƙila da kamar naira miliyan 5 ko 10 zan yi.
Kamar yadda mafarkin ka ya zama gaskiya ta hanyar shiga gasar Airtel Recharge and Block Promo ta inda kowa zai iya samun nasarar lashe kyauta. Cika ka'idar adadin saka kati a mako don ka more kyautar kuɗaɗe da yawan su ya kai naira miliyan 100. Gasar za ta ci gaba har zuwa watan Disamban shekarar 2021. Don ƙarin bayani, danna *444*4#.
Airtel, the smartphone network.
Likitan haƙora me kuma cavities kuma ta yaya man goge bakin Colgate yake kare haƙorina daga cavities? Shin yana kawar da shi ne?
A'a, yawancin sanadiyar ciwon haƙora daga ramin da haƙori yake yi ne da ake kira cavities. Idan kana goge baki a kullum tare da Colgate Maximum Cavity Protection, tsarin aikin sa ne ya nutsar da sinadarin calcium kan cikin haƙora ya kare su daga yin rami.
Lokaci ne na inganta rayuwarmu zuwa ga amfani da Colgate man goge baki da kuma duniya suka zaba.
Because Colgate locks calcium in.
Yes, cavities out!
Colgate ya samu amincewar ƙungiyar likitocin haƙora ta Najeriya.
Welcome back from that commercial break. I did promise that it would be short, and it is time for us to come back to what you were saying, that worldwide there is agreement that this is irreversible. The damage that is caused by glaucoma is irreversible. Yeah, that was where you are when we went on that commercial break.
This I said is based on research. And even in Nigeria, research was conducted, like I said, in 2017 that supports this saying. And even within our hospitals, we've conducted researches that depicted, that showed a similar picture. So it's an agreement that is based on research. And like you said, risk factors, till date, we've not been able to pinpoint what exactly causes glaucoma, but there are researches that pointed to genetic, that has some genetic basis. So for that reason, it's believed to be inherited. And then it's been seen in relatives of patients with glaucoma that they come down with glaucoma. In fact, if you have twins, a twin of an individual with glaucoma has twice risk, 2 times risk of having it compared to general population. And if a father has glaucoma, his offspring have 4-fold risk of coming down. So it has some genetic basis based on that, and these discussions are based on research. And also, people with hypertension, have been noticed to also have this glaucoma based on research, and people with diabetes, there are researches that also pointed out to individuals with diabetes, and there are more technical researches, even taking some pills, have been shown pregnancy, but these are very technical discussions if you want to discuss these things. But all these factors have been seen to be associated with or increase the risk of individuals of having glaucoma.
So you said something very interesting right now. You mentioned pregnancy, that this could also be a trigger or a condition that could lead to a woman developing or someone developing glaucoma. So talk to us about that briefly, because I'm sure that a number of pregnant women would want to know what kind of signs, or is it symptoms we should talk about now, that they could start to experience that they need to get to the doctor quickly. Now, quickly, I must tell you, as a woman who has also had children, there's a tendency, especially after you've had your first kid, for people, not just the women now, but even the women included, to downplay some things. You feel some things and you're just like, oh, it's because I'm pregnant, once I lie down or something, it's going to pass. At what point, as regards glaucoma, should a pregnant woman not ignore the signs or symptoms that she's experiencing or seeing?
Okay. Generally, glaucoma, the symptoms in glaucoma is usually a general sign or symptom.
All right, we apologize for that. We must continue. We are resilient people. All right, so for those who have been following, we've been talking about more serious eye conditions with Dr. Mohammed Okpanaki, and we were talking about glaucoma, and he had mentioned pregnancy and had asked, as regards pregnancy, at what point should a pregnant woman go to see her doctor immediately? And you were saying, Dr. Okpanaki.
Okay, thank you. I was saying that glaucoma generally, whether in diabetes, hypertension, or in hereditary, they all come with the same symptom or sign. So any woman or anybody at all that is experiencing deterioration in vision that is painless, you need to see your doctor. Whether painless or painful, you need to see a doctor, specifically an eye doctor. That's it. And for pregnancy, like I said, we've not been able to pinpoint the real cause scientifically, but research have shown that pregnancy is a risk factor for it, and that's why I stated that pregnancy is a risk factor. So there is no specific symptom, because in addition to glaucoma, there are other conditions that can give a pregnant woman poor vision. So it's not just glaucoma. So
I apologize once again. This isn't us, and you know it. But then there are days like this. Dr. Okpanaki, just go ahead quickly, because I want to have the lines open before something else happens.
It's all right. Okay, we're discussing.
Yes, the pregnancy thing. You said you didn't want to, alarm anyone, but any eye sight degeneration in pregnancy.
Exactly. A lot of things happen to women during pregnancy. A lot of physiological changes, hormonal changes, happens to women, and some of them tend to affect their sight, in some ways. So basically, that's it. But if talking about signs and symptoms of glaucoma, like I said earlier, symptoms are generally the same, but there are two types of glaucoma. Basically, for public health and education, we term them as either open angle glaucoma or angle closure glaucoma. And some of glaucoma can come as an emergency. We've seen emergencies that are glaucoma. You know?
That's it. Just started suddenly. Is that
yes.
what you mean? Okay.
It starts suddenly. In this case, patients come down with pain because initially I said most glaucomas, most at times, is usually painless. There is painless progressive deterioration in vision in glaucoma. You know,
painless.
It's painless.
Okay.
An individual just notice, and the funny thing about glaucoma is you may be able to see as far as possible, but it's eating up your eye, because by the time you notice that your vision is gone, it means the glaucoma has actually eaten maybe up to 60-70% of your side, when it's even subtle. By the time most people notice that my vision is really poor, maybe it has eaten 90 or more percent of the nerve. 90% of the optic nerve is eaten up. And the way the worsening of vision occur is in such a way that if you are not very observant, you might not notice as an individual, even the patient, especially for us who have this poor attitude to hospital visits, you know. Now, if you look straight, you realize that you can still see. If you close one of your eye, you can still see the periphery. You know, you can still see side by side. But in glaucoma patients, the way the nerve is damaged is in such a way that you'll be having constriction of your visual field. Visual field is the extent to which you can see sideways. Now, if glaucoma is eating you up, if it is eating an individual up, you'll have this constriction. You realize that the side, the sides become dark and the center, it's clear. So you can see through it. It will be as if you are seeing through a tunnel. If you are seeing through a tunnel, you can only see within the tunnel. Of course, you can't see side. And that's why it gives you a tunnel vision,
So that would be what type of, the open angle?
No, generally.
Okay,
glaucoma. Generally.
Okay.
Yes. Generally, for every glaucoma, that's what happened. You have it eating up the periphery and then only have a tunnel vision. Every individual has a funnel vision. Funnel vision is in the sense that the farther you see, the wider your field of view.
Right.
Yes. But for glaucoma, you just realize that the person have a constricted vision. It's a tunnel vision instead of funnel. Now, in addition, some people or some of these patients, because they have a tunnel vision, when they are walking, they can't see things that are by their side. They just bump into them, especially in places where they are not used to. Maybe they visit a house, or maybe I just get into the studio, or somebody who is driving and wants to turn through a roundabout will just suddenly start hitting the roundabout instead of going, because he can't see sideways. When the pressure, one of the problem in glaucoma that causes damage to the nerve, is the pressure. And that is what we as health, as ophthalmologists or doctors try to control. There's a high pressure in the eye that damages the nerve. And that is what we try to control.
What is high? When we talk about BP, we know that is the pressure of the blood. In the eye, what is going high?
There is a fluid. There's a fluid that is called the aqueous humor. This aqueous humor is ideally supposed to be produced at certain quantity and is drained through certain parts. It's very minute. But if this fluid that is called aqueous humor is not properly drained, or is not drained for some reason, there will be build-up of this aqueous humor in the eye, and then the pressure rises. That's one of the ways. Or when there is excessive production and the body is not draining it fine, there will be pressure build up in the eye. So it's similar to hypertension. In hypertension, you have damages to the brain, people having stroke, people having heart diseases, kidney diseases from the high pressure. In this case, the high pressure is targeting the nerve. So when you have this high pressure, it can give the individual what we call halo, where an individual sees what looks like a rainbow around light.
Oh.
Yes. So it's
when
one
you
of the
look at the light, you see
look
like
at above, especially these yellow bulbs.
Yes.
You just see what looks like a rainbow around
the bulb.
So it gives you an idea of high pressure, you know. So these are the things, subtle things you see for normal open angle glaucoma. For angle closure, there are different types. There's the acute and then there's the chronic. Chronic means the individual has, the aqueous, like I said, is supposed to drain through a structure. That structure is located at a place that is tagged the angle in the eye. So for open angle, this angular part is open, but there's a problem with drainage. But for angle closure, that angle is closed. Of course, the fluid cannot even get access to the angle for it to be drained. And that's where the problem of angle closure is. Now, these individuals, they can be having these angles closed intermittently, and the angle is 360. The angle is located 360 in the eye, is round. So some individuals can have it that, okay, this angle is closed for a while and then it opens. So before the pressure builds up, it opens. So they will be having moments of angle closure, and so it becomes chronic. It takes time. It will be behaving like an open angle. But for individuals that have this closed, some individuals who have this
the
closed angle can occasionally have acute attack, in that this angle suddenly close and the pressure
builds up
immediately, and realize that they start having pains, all sort of redness, photophobia, like they don't want to see lights. If they look at lights, there are a lot of rainbows, and what have you. So these patients come to us as emergencies. For those who are lucky, at this point, there are some interventions you can make to halt or avoid this kind of scenario from happening. So as this pressure build up, for people who are unlucky, we've seen people who have this acute attack and they think it's something mild, and they don't take care of this problem, and within days their sight is gone. Because
within days,
because the pressure is extremely high, and it compresses or damages this optic nerve at a very fast rate, that within days they can go blind.
Okay.
Yes.
Doc, I need to stop you there. The people need to speak with you, but we need to go on another commercial break. When we get back, the lines will be open immediately for us to get to talk with Dr. Okpanaki. You're still listening to Your Health 360. Do stay with us right here on Invicta 98.9 FM. All right, we do not have as much time as would like. However, we can still get in one or two questions or even more if we're able to get people. The network is friendly and people are able to stay away from their radio sets. You know the drill. Time for us to get your questions to Dr. Okpanaki, and the lines are open. The numbers are 081 40,000 989 and 070 800 989. I'll call that again. It's 081 40,000 989, and then we have the other number that is 070 800 989. Let's go take your calls. Please remember to step away from your radio set so that we can have a good conversation. Hello, good evening.
Hello, good evening, ma.
Good evening, you're welcome, sir. Go ahead.
Good evening, ma. Good evening, sir.
Good evening.
Hello, sir. My question goes like this. Are you hearing me?
Yes, I can.
Yeah, what in a situation where someone have eye problem, and in the medical center they look for operation. Later, when the day come, they say they could not do the operation again. What can they do for the person now? Because the eye problem is still there.
What reason did they give for saying they wouldn't do the operation?
They say because they say there is sky on the main, that's the main eye that they see, that small eye.
Okay.
That blood then there. So later they booked me for operation. When the day came, I went there. Another doctor came, check. They said they will not be able to do the operation. And up to now, the eye is disturbing me. So I don't know what to do. And my question is, what would be the alternative again? Is there any alternative for me to do it again?
Okay. Thank you very much for your questions. I don't know your name, but I got your question. Yeah.
All right.
So the thing about the eye is for you to do operation on an eye. One, the public have to understand that when you go to the hospital, you are at liberty to ask questions on your problems, because as you are talking to me now, I only have some assumptions in my head to respond to your question, because I won't know exactly what the problem is. But you mentioned scar, and that's one important thing. For you to operate an eye, there's a place called the cornea. This cornea is a very transparent structure that forms the eye. That's where light passes through. And for you to do any operation inside the eye, this cornea has to be clear for you to see inside the eye. So if you have a scar, that scar will ultimately prevent whatever thing one can see. Nobody can see beyond that scar. You know, scar in the eye is usually
scar in the first place?
Maybe trauma, there are a lot of things that can cause scar. Okay. One of the common things we know of is trauma. Some people have measles during childhood, and then it comes with a lot of problem in the eye. Some people have infection of that cornea, and as it heals, it leaves a scar. And usually you see it as a whitish patch, around the eye. So whoever is going to do the operation cannot see beyond that scar, and so he won't be able to do it. Probably somebody saw something different, or they were anticipating something and they couldn't.
So you mean if there's a scar, they cannot operate on that eye? There are no procedures?
No. If there's a scar, what they do is to do a corneal transplant, which is something we are very fortunate to do. It's something they do in the developed world, but in Eye Center here, we are fortunate at a very relatively an affordable rate compared to when you have to go abroad to get these things. People go to India, UK, and what have you to get these things done. We have a surgeon that currently does operation.
Corneal transplant?
Yes, corneal transplant in Eye Center. They do it
from other people?
Yes.
Okay, I just needed to know.
Process. There's a transplant, that can be done if there's a scar. But it depends on what the individual see. You have to be qualified to even go for that transplant, because you can have a transplant and it will fail. So there are criteria you fulfill to even get to that stage of transplant. So most likely, as much as if you go to your hospital, they want to help you and they want to make you see. If you realize that they are telling you they can't do, they will tell you why they can't do it. And I'm sure they've told you, but if they didn't, you can still go and inquire during your next visit.
I do hope that he did go to the Eye Center. I always tell people that yes, government process, especially as regards health, might be long and cumbersome, but it serves us better at the end of the day because of the charlatans. So many charlatans out there that we cannot play with our health. Still taking your calls this evening. We can take a few more calls before we have to go. And the lines are still open. The numbers are 081 40,000 989 and 07087 800 989. Still taking your calls this evening. All right. We did talk about corneal transplants, and I know that you said that a lot goes into all of that. But Is it from living beings that you get? Okay, so we're not even going to go into that. Let's not do this. Let's take this call. The calls are more important. Hello, good evening.
Good evening.
Yes.
Please, can a glaucoma patient get married?
Can a glaucoma patient get married?
Get married. Yes.
Okay, I guess he's worried about, passing it on. Are there things you need to know about your wife-to-be before you make that decision? Last week you talked about the Coke kind of glass, those thick, thick glasses, and telling people not to get married. So the question here is about glaucoma.
Okay, in glaucoma, you actually won't tell anybody not to get married. The fact that is a chance. If we said it can be inherited, but it's not 100%, and there's no pattern to it. It's not like sickle cell where you have, if a mother is AS and this one is AS, don't marry. It's not the same thing. Glaucoma can marry, but of course, if you want to marry, there's this thing about diseases. If you want to marry, you should try to marry somebody you feel is healthier in not having the same disease as you do, because diseases like this, of course, if you have them genetically, if you are genetically make up to have this from mother and father, then the child is likely to have. So if a wife is having glaucoma, as much as possible, considering the hereditary trait of it, we can discourage that.
So for instance, you're talking with your girlfriend or wife-to-be and she so happens to mention that, my mom had glaucoma at one point and you have a parent too who had glaucoma, you might want to think about getting married. Is that what you're saying?
Well, I'm not sticking out my neck to that fact, but I'm just saying that it is hereditary. It can be inherited. So as much as possible, you don't want to have a combination of genes that will give you, there's a likelihood if these things can be inherited from if a father has it, his children can have. Then you're not having a father and a mother having, but most of the times, again, about glaucoma, one of the risk factors is age. So younger people, if you try to screen young people, you might not see anything. You might not find anything. People want to marry and, okay, her father has glaucoma and your father has glaucoma. You might screen at that point and you don't get anything. But with age, with time, it can manifest. Because the onset of glaucoma is usually 35 years in us, Africa.
If someone is going to, if a patient is going to have,
you can have it. A patient can have it earlier, but the risk factor from research is after 35 years in Africa. Why the whites, the Caucasians, have it after 40 from research. So it's faster. The occurrence is faster in Africa than the Caucasian. And then treatment-wise, the Africans are more resistant to treatment. And that's why a lot of Africans go blind from glaucoma compared to the Caucasians.
Okay.
Yes.
Are there things that we can do, as because we have to go now, but are there preventive measures or measures that slow down
progression? Exactly. Like we said, prevention. It can't be overemphasized. Parents that have glaucoma, in fact, relatives, other parents, children that have glaucoma, sisters, immediately we see them, one of the first points, or one of the first things we try to establish, if they have relative or a father comes with his children, we try at that point to screen the child or daughter, whichever, son or daughter. We try to screen that child, or relatives. If they are related, we try to screen them. So, and then we educate the father about his condition as a form of counseling, and they will tell him to bring, and a lot have done that. And in the process, we have on some occasions catch patients or patients of relative coming to hospital. They just escort their parents and then they found out that they are glaucoma. So if we get to know early, what we will do is to institute treatment there are different modalities of treatment. Treatments with drugs and what have you, gives us an edge. It allows us to slow down progression if instituted early, compared to when an individual is already blind and coming to hospital. Nobody can help you because you can't do transplant of that nerve that is already damaged. If he's gone for now. Researches are ongoing, but nothing for now.
It's gone.
Yes.
Now, it's a great thing then that the CMD of the Eye Center has decided that people can actually just walk in and screen themselves. I think this is a good thing, especially for those. Just yesterday.
Yes.
Well, we hope that,
people will take responsibility of their health and visit the hospital more often.
We also hope the hospital will put its money where its mouth is. If the CMD has said this will happen, here's hoping that it will happen. People can come in, screen themselves, screen their children.
We have glaucoma week. They're usually in April. I think I made mention of it during my last visit. Yes, it's usually in April, and it's a whole week dedicated to glaucoma. Unlike cataract that you can have surgery and you can see again. If it's gone, it's gone. And we dedicate a whole week. And our CMD also the management is magnanimous enough to allow people to come in at these times to get screened. And we try to catch relative of people that come with to get screened. This thing can be sporadic or inherited. We don't really know. So we just try to screen everybody, especially people that are beyond 35 years, where the risk is more. Because the risk of blindness increases with age. And so we try as much as possible at that time to screen patients.
Dr. Okpanaki, the time is up. Unfortunately, there was so much I wanted us to talk about: macular degeneration, which, age-related, and cataract, and the rest of it. Hopefully, we'll have you back soon enough to come and talk to us about some of those conditions. To all those people trying to call and have not been able to pick your call, I apologize, but the time is up. Dr. Okpanaki, thank you so much.
Thank you for having me.
Until next week, when we hope to come your way again, please do take very good care of your health. Remember that For the Place is up next, and only God knows what those men are going to get up to this time around. Have a victorious weekend ahead.